Thank you for watching HPSM's provider onboarding video on HPSM programs and resources for members. Quality care for our members is our top priority, so we appreciate you taking the time today to join us. In this video, we'll cover how to learn if a member is eligible for coverage, programs we offer, and more. One of the first things HPSM providers need to know to care for our members is to check for a member's eligibility. There are many ways to check a member's eligibility depending on the member's line of business. You can visit our provider portal or call our 24-hour automated telephone eligibility verification line for all members. For Medi-Cal members, you can also call 650-616-2133 or visit the Medi-Cal website. HPSM is California's first ever managed healthcare plan that fully integrates dental, medical, and behavioral healthcare benefits. HPSM offers mild to moderate behavioral health services to members. Please make sure you use the behavioral health referral form and the Access Call Center if you think a member may need mental health or substance use treatment. The Access Call Center will route members to the appropriate systems of care. You can learn more about behavioral health programs and referrals by visiting www.hpsm.org/provider/behavioral-health/. HPSM is also proud to offer dental services to our members. More information on dental programs can be found at www.hpsm.org/provider/hpsm-dental. Please make sure you familiarize yourself with our mild to moderate healthcare benefits for members as well as dental and medical. HPSM's membership is over 170,000 strong. Our members come from everywhere in the world. Almost half of our member population identifies as Hispanic or Latino. Our members also largely identify as Asian and Pacific Islander, Caucasian, and Black. Our members speak dozens of different languages, including Spanish, English, Mandarin, Cantonese, Tagalog, and more. Nationally, communities of color are more at risk for negative health outcomes and discrimination due to past and present social injustice. At HPSM, our mission is to address these inequalities by ensuring high-quality care for all San Mateo County residents, regardless of insurance type. By becoming an HPSM network provider, we know that you share this commitment. To support you in achieving this shared goal, we've developed tools to help you provide culturally and linguistically appropriate services. At the individual level, cultural awareness will ensure that HPSM members, your patients, feel heard, understood, and supported in their healthcare experience. At the community level, culturally informed care can help reduce racial and ethnic disparities in healthcare. To continue building upon cultural awareness and humility practices, this training will go over ways that institutional and structural racism impact members' lives and ways that HPSM providers can help combat some of those impacts. Cultural awareness and humility is an ongoing experience, so please remain open to learning and support a learning environment in your practice or facility. Institutional racism includes policies or behaviors within an organization that discriminate against people based on race or ethnicity, either intentionally or unintentionally. This discrimination against communities of color in our organizations impacts socioeconomic status, education level, health outcomes, and employment. Structural racism is a system in which those policies and laws perpetuate racial and ethnic group inequality. Because discrimination against people based on their race is pervasive in our institutions and cultural norms, racism is often not explicit or conscious. To best serve our member population, it is important that we understand what kind of daily inequalities they experience that impact their health and wellness, and our own implicit biases. The best way to address institutional and structural racism in your practice is to take a patient-centered approach and treat every member like an individual. Shy away from making assumptions about your patients based on their racial or ethnic backgrounds. Avoid trying to relate to patients based on the identities they hold, as this often perpetuates microaggressions and discriminations at large. Ask them questions to get to know them more as individuals, then create a treatment plan together. Federal regulations prohibit discrimination on the basis of many factors, including age, race, color, national origin, disability, religion, or sex. Cultural beliefs on health may affect perceptions of health, illness, and death, and may influence how an individual approaches these topics, including where patients seek help, types of treatments patients prefer, and more. Use clear communication and normalizing statements to establish trust with patients. Be sure to ask about potentially relevant traditions and customs, as well as the extent to which your patients feel these impact their healthcare decisions. Home remedies, while common across many racial and ethnic groups, may be used more often by communities of color because of cultural, financial, and trust-related factors. When treating patients, it is important for providers to remember to take a patient-centered approach and work with members to understand what remedies they like that work for them. A treatment plan can be created with these in mind to provide a holistic and more positive healthcare experience. It is important that you and your patients can understand one another so that they can take an informed and active role in their healthcare. Providing language assistance for HPSM members with limited English proficiency or sensory impairment not only ensures high-quality care for your patients, it's also a contractual requirement for all behavioral health, medical, and dental providers in HPSM's network. HPSM therefore offers free on-demand interpreter services from a qualified interpreter by phone, video, and in certain circumstances, in person. It is a responsibility of the provider in partnership with the Health Plan of San Mateo to provide an interpreter for members. Members should not be asked to acquire their own interpreter. This includes requesting one from HPSM, being asked to bring in a family member, or using free translation services like Google Translate on their cell phone. Members should never be denied care because of their preferred language. HPSM language assistance services allow providers to provide information in a member's preferred language at every point of contact during a health encounter. Understanding these services will not only help you meet state and federal regulatory requirements, but will also help you provide high-quality care to your patients. More information on what is required can be found in your provider manual. Resources for accessing these services are available on hpsm.org. For questions or to request an in-person interpreter, email interpreters@hpsm.org. Health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Even when language is not a barrier, medical terminology, emotional responses, and stress can all interfere with people's ability to understand health information and treatment options for themselves and their loved ones. This can affect their ability to make informed healthcare decisions and may ultimately lead to worsened and preventable negative health outcomes. Even when you've established trust with a patient, they may not feel confident in saying they don't understand a diagnosis or a treatment plan. Because of this, the responsibility of health literacy lies with the provider, not the patient. You can make healthcare information more accessible by utilizing interpreter services for members with LEP, using techniques like teach-back method when talking with patients or their care providers, ensuring that all appointments are accessible for all patients at all points of contact, and providing tools to support patients in getting the care they need. More health literacy resources for providers and HPSM members are available on the HPSM website. Please make sure to continue building upon health literacy and humility practices, as it's an ongoing, unending learning experience. Gender-affirming care is a supportive form of healthcare that includes medical, surgical, mental health, and non-medical services for transgender and non-binary people. It is patient-centered, aligning members' outward physical traits with their gender identity. Prioritizing gender-affirming care is important because transgender and non-binary adults and adolescents are more at risk for poor mental health, substance abuse, and suicide. Ensuring that we have the appropriate resources and supportive, inclusive language can help mitigate those disparities. To make your practice more gender-affirming, here are some things you can do. Share and list your pronouns, make all gender restrooms available, use gender-inclusive language on forms and during health encounters, and ask and use members' preferred names. More tools to support providers and tips for supporting LGBTQIA+ patients are available on the HPSM website. The HPSM website is divided into two categories, web pages for providers and web pages for members. If you've watched the other videos in the series, you are probably starting to get familiar with our provider web pages. Some of our provider pages have content like clinical guidelines and information on how to refer members to programs that are meant to help providers support members. You can find those pages by scrolling down to the menu at the bottom of our provider homepage. Each has its own page with unique resources, so make sure you review them thoroughly. Make sure you check back often as we're always updating content and launching new programs to support our members. Now let's review some of our most popular programs for members. Members who have prediabetes, are at risk for diabetes, or who are having difficulty following diabetes health guidelines can contact the Health Education Unit at 650-616-2165 for information about health education classes and programs. They can also visit the website at www.hpsm.org/member/health-tips/health-conditions/diabetes for more resources. Members who have prediabetes or are at risk for diabetes are eligible to join our diabetes prevention program. Providers can visit www.hpsm.org/provider/resources/diabetes-prevention-program to learn more about the program and eligibility and submit referral forms. Here are some other program highlights. Our prenatal and postpartum care program has been expanded and rebranded to the Baby and Me program. The program will continue to include our incentive for timely prenatal and postpartum care. We will also provide information on how mothers and their babies can receive more comprehensive care. You can learn more and find the referral form at the website listed on the screen. Providers are required to ask members about tobacco use at the first visit, annually, and at any relevant visit. Wherever a patient is in their journey, encourage tobacco cessation by asking permission to talk about their tobacco use and readiness to quit, advising them to quit, offering brief counseling, and more. Providers are also encouraged to refer members to the Kick It California helpline at 1-800-300-8086 or online at the website you see on the screen. To learn more about resources, clinical guidelines, and toolkits available to support you in helping your patients quit tobacco, visit www.hpsm.org/providers/resources/tobacco-cessation-resources. We also have resources for diverse populations like mothers, seniors, persons with disabilities, and more. Visit any of the links on your screen to learn more about these programs. Providers can also connect eligible members to CalAIM resources. CalAIM is a California multi-year initiative that is designed to improve health outcomes for our most vulnerable populations in the state by focusing on and prioritizing holistic, preventative, and patient-centered care. Learn more about CalAIM, eligibility, and how to connect eligible members to enhanced care management and community supports at www.hpsm.org/providers/CalAIM-at-HPSM. Other resources for members online include health education materials like our health tips, where we place great emphasis on primary prevention. At HPSM, we believe preventing a disease is the most effective way to keep a person healthy. Our health tips online offer a wide variety of health information and tips for staying healthy. Members can access our health education guide online at www.hpsm.org/member/health-tips. Health Matters is HPSM's biannual member newsletter. It includes articles on a variety of topics to help keep our members healthy. To view current and past issues of Health Matters, visit the website on your screen. Those are just some of the resources at your disposal to support HPSM members. Our website is constantly being updated with new content, so check back frequently. If you have any questions, please contact HPSM at psinquiries@hpsm.org. Thank you for watching, and please see earlier videos in this series if you haven't already.